As a psychiatric nurse and mental health nurse specialist, my research is in mental health and substance abuse, and I started with this research in my master's studies in 2008. And the topic of my research was exploring the perceptions of psychiatric patients regarding marijuana use, and why that topic is because of the fact that majority of the psychiatric patients or mental health care users who are admitted in public mental care institutions, they have history of use or abuse of marijuana. That is why I chose this area for my research. And then in my PhD, I developed an illegal substance use prevention program for adolescent learners here in the Northwest Province. And there I wanted to prevent the use of substances or drugs, and all of them. Example can be dagga, marijuana, alcohol, heroin, cocaine, glue, nyaupe, and others. And with the research that we are doing here in our faculty or in our entity, we encourage researchers to publish it and in high impact factor journals. So even my research is published in those high impact factor journals, and nowadays we are focusing on the journals where we can publish for free. Now, one of my responsibilities here in the entity is to encourage staff to publish more, is to encourage staff to complete their masters and PhDs, those who are doing it. And in our entity, we have sub-programs. We have researchers who are focusing on prevention of cardiovascular diseases, respiratory diseases, cancer, diabetes, and mental disorders. So I'm in the sub-program of mental disorders, because it is one of the most common types of non-communicable diseases, which is our main focus to prevent non-communicable diseases. So that is the focus actually of the entity. But we are focusing on all non-communicable diseases, like as I've mentioned, cancer, diabetes, cardiovascular disease, respiratory, and mental disorders. So that is all that we are doing in the entity. But for me, my research is mainly on prevention of substance abuse, especially by the adolescent, because they are the future of tomorrow, and they are the ones that are using the substances from a very young age of 11, 12 years. So that is why I'm focusing on prevention of substance abuse. And my research, fortunately, we are now, it is in line with the new NW strategy of 2024 and beyond, because we are encouraging the researchers in the entity to integrate their research with community engagement. And that is what I'm currently doing, because I'm collaborating with Department of Basic Education, Department of Health, Department of Police, and other NGOs, where we are fighting the use of drugs among the youth. So every time after doing research, we want to go back to the community to share the results or to publish in journals, because we are saying we cannot do research without making an impact, without going to the real people who are having serious issues of the use of drugs or alcohol.